Let me ask you something, and I want you to be really honest with yourself as I do. Have you recently received a blood test result that showed your creatinine level was higher than it should be? Did a doctor mention the words kidney function or GFR or chronic kidney disease? And did those words land in your chest like something heavy and unresolved? Did you nod, take the paperwork, go home, and then spend the next several days quietly searching for answers that either frightened you more or left you more confused than before? If any part of that resonates, you are not alone, not even close. Elevated creatinine is one of the most common findings in adults over 60, and it is also one of the most misunderstood. People are handed a number, told it is too high, and sent home with very little practical guidance about what they can actually do today, this week, to change the trajectory. That ends right now. I'm Dr. William, your Senior Health and Wellness Consultant, and in the next 15 to 20 minutes, I'm going to walk you through 5 specific science-grounded actions, things you can begin doing immediately that research shows can meaningfully support kidney function, help bring creatinine levels down over time, and protect the kidneys from further damage. I want to be honest with you about what this conversation is and what it is not. This is not a promise of a cure. This is not a substitute for your physician's guidance. What it is a calm, evidence-based roadmap for taking the most important protective steps available to you at this stage so that you walk into your next appointment as an informed, empowered participant in your own care, rather than a passive recipient of someone else's decisions. If you've been told your creatinine is significantly elevated or your kidney function is severely compromised, please work closely with your physician or a nephrologist. The steps in this video are supportive and evidence-informed, but serious kidney disease requires professional medical management. For everyone else, let's get into it, because time in kidney health genuinely matters. What elevated creatinine is actually telling you, the number on the page, and what it means. Creatinine is a waste product, entirely natural, produced continuously as your muscles break down a compound called creatine for energy. This process never stops. Every contraction, every movement, every moment of muscle activity releases a small amount of creatinine into the bloodstream. Under normal circumstances, the kidneys filter creatinine out of the blood with considerable efficiency and excrete it through the urine. Creatinine levels in the blood stay within a predictable range, roughly 0.7 to 1.2 milligrams per deciliter for men and 0.5 to 1.0 for women, though laboratory reference ranges vary slightly. When those numbers climb, it tells us something specific. The kidneys are not clearing creatinine as efficiently as they should. Their filtering capacity, what physicians measure as the glomerular filtration rate, or GFR, is diminished. The higher the creatinine and the lower the GFR, the more the kidneys are struggling. The question that always follows is why? And the answer matters enormously because different causes call for different responses. Why creatinine rises, the causes worth understanding. In adults over 60, the most common drivers of elevated creatinine fall into several overlapping categories. First, the natural aging process itself. Kidney function declines gradually with age. Filtration capacity decreases by roughly 1% per year after 40, meaning that by the time many people reach their 70s, they may have lost 25 to 30% of their peak kidney reserve. This decline is not a disease in itself, but it narrows the margin for error considerably. Second, chronically high blood pressure, hypertension, is one of the most damaging forces the kidneys face. The tiny capillaries that form the kidney's filtering units, called the glomeruli, are exquisitely sensitive to pressure. Year after year of elevated pressure stiffens and narrows these vessels, reducing blood flow and gradually destroying the very structures responsible for filtration. This is why hypertension is both a cause and a consequence of kidney disease. Each condition worsens the other. Third, type 2 diabetes and chronically elevated blood sugar. When glucose remains high in the bloodstream over long periods, it damages the delicate capillary network of the glomeruli through a process called glycation. Essentially, sugar molecules binding to and stiffening protein structures in blood vessel walls. This is the mechanism behind diabetic nephropathy, one of the leading causes of kidney failure globally. Fourth, dehydration. Far more common in older adults than most people realize. As we age, the sensation of thirst becomes less reliable. Older adults can become significantly dehydrated without feeling thirsty. When the body is dehydrated, blood becomes more concentrated. Blood flow to the kidneys decreases and creatinine levels rise, sometimes dramatically and sometimes acutely. In many cases, what appears to be worsening kidney disease is partly or significantly driven by chronic mild dehydration. Fifth, certain medications, both prescription and over-the-counter, are nephrotoxic, meaning they place direct stress on kidney tissue. Non-steroidal anti-inflammatory drugs like ibuprofen and naproxen, certain antibiotics, contrast dyes used in imaging scans, and some blood pressure medications at excessive doses can all affect kidney function and creatinine levels. This is not a reason to stop medications without guidance. It is a reason to have an informed conversation with your physician. Why acting now, before things worsen, is the critical decision. Chronic kidney disease progresses through stages. In the early stages, when creatinine is mildly elevated and GFR is still relatively preserved, there is significant room for dietary and lifestyle interventions to slow progression and in some cases partially improve function. The interventions we are about to discuss are most powerful at this stage. In the later stages, when substantial nephron loss has already occurred, the kidneys are less responsive to lifestyle changes, and the focus shifts toward management of complications and preparation for more intensive interventions. The window of greatest opportunity is now, in the early and moderate stages. The stages where most of the people watching this are likely to find themselves. This is not a moment for panic. It is a moment for precision, for deliberate action, for doing the right things consistently, beginning immediately. Let's talk about what those things are. The 5 immediate actions: what to do, why it works, and how to start today. Hydrate, deliberately, consistently, and starting today. The simplest intervention with the most immediate impact. Of all 5 actions on this list, this one is the fastest to begin, the cheapest to implement, and for many older adults with elevated creatinine, it will produce the most visible change in blood test results in the shortest time. Here is why. The kidneys filter blood. They require adequate blood flow to do this work, and blood volume is directly dependent on hydration status. When you are even mildly dehydrated, blood becomes more viscous. Blood pressure in the kidney's microvasculature changes, and the kidneys receive less of the flow they need to filter efficiently. Creatinine, which cannot be excreted without adequate urine output, accumulates. For older adults, the relationship with hydration is complicated by a physiological reality that most people don't know about. The thirst mechanism becomes less sensitive with age. A young person becomes thirsty when they have lost approximately 1 to 2% of body water. An older adult may lose 3 to 4% before feeling the same urge. This means that by the time an older adult feels thirsty, they are already meaningfully dehydrated. Add to this the fact that many older adults deliberately restrict fluid intake to avoid frequent bathroom trips, and you have a population that is chronically underhydrated in ways that directly and continuously stress the kidneys. The solution is deliberate hydration, drinking water on a schedule rather than relying on thirst as the signal. Most adults with mild to moderately elevated creatinine and normal or near normal urine output should aim for 6 to 8 glasses of plain water per day, adjusted for body weight, climate, physical activity, and any physician-imposed fluid restrictions. Herbal teas, particularly dandelion root and nettle tea, both of which have mild diuretic and kidney supportive properties in the research literature, are excellent contributions to daily fluid intake. Clear soups and broths, water-rich fruits and vegetables, including cucumbers, celery, watermelon, and zucchini, all support hydration while delivering additional nutrients. Fluids to reduce significantly include caffeine in large quantities, which has a mild diuretic effect, alcohol, which is dehydrating and carries additional metabolic costs for kidney tissue, and sugary sodas and energy drinks, which add glucose and phosphorus loads the kidneys must manage. Set a water reminder on your phone for every 2 hours from waking to mid-evening. Fill a 1.5-liter bottle each morning and make finishing it your daily non-negotiable. Track your urine color. Pale yellow indicates good hydration. Dark amber means you need significantly more fluid. Reduce dietary protein, especially from red meat. This is the dietary change that has the most robust and consistent evidence base in the management of elevated creatinine and early chronic kidney disease. And it is also the one that most people find counterintuitive, particularly in an era when high-protein diets are widely promoted for older adults. Here is the biology behind it. When you eat protein, especially animal protein, your body breaks it down into amino acids and, critically, nitrogen-containing waste products. These waste products, including urea, uric acid, and creatinine itself, must be filtered out of the blood by the kidneys. The more protein consumed, the greater the volume of nitrogen waste produced, and the harder the kidneys must work to clear it. For kidneys functioning normally at full capacity, this is manageable. For kidneys already operating at reduced efficiency, as is the case with elevated creatinine, the additional filtration burden from high protein intake can accelerate the very damage you are trying to stop. Multiple clinical trials have demonstrated that reducing dietary protein intake in people with chronic kidney disease slows the rate of GFR decline, meaning it slows the progression of the disease itself. This effect is most pronounced with reduction in animal protein, particularly red meat, processed meats, and very high protein foods like organ meats. The recommendation for adults with elevated creatinine and reduced GFR is generally to target between 0.6 and 0.8 grams of protein per kilogram of body weight per day, significantly lower than the 1.2 to 1.6 grams often recommended for older adults without kidney concerns. For a 70 kilogram person, that means roughly 42 to 56 grams of protein daily. This does require some awareness of portion sizes, but it does not mean eliminating protein. It means being thoughtful and deliberate about sources and amounts. Plant-based proteins such as lentils, tofu, chickpeas, and eggs in moderation produce less nitrogen waste than red meat for the same protein content and are generally better tolerated by compromised kidneys. Fish and poultry, consumed in moderate portions, are preferable to red meat. Red meat, processed meats, and very large protein portions at single meals should be significantly reduced or avoided. Start today. Remove red meat and processed meats from this week's meals. Replace them with lentil-based dishes, tofu, or fish. Keep protein portions to roughly the size of your palm at each meal. Discuss your specific protein target with your physician or renal dietitian, as the right amount depends on your GFR and individual situation. Eliminate salt and hidden sodium from your diet, protecting the blood vessels your kidneys depend on. Sodium is without question one of the most damaging dietary factors for kidney health, and it operates through a mechanism that creates a damaging cycle the kidneys are powerless to escape on their own. When sodium intake is high, the body retains water to maintain appropriate sodium concentration in the blood. This increases blood volume. Increased blood volume raises blood pressure, and elevated blood pressure, as we discussed earlier, is one of the most destructive forces on the kidney's delicate filtering structures. The kidneys, already struggling to maintain filtration capacity, are now contending with higher pressure being driven through their most sensitive tissues. The result? Glomerular damage accelerates. Protein begins leaking into the urine, a sign that the filtering barrier has been breached. Creatinine rises further, and the kidneys are pushed further down a path that becomes progressively harder to reverse. For adults over 60 with elevated creatinine, the sodium target recommended by most nephrology guidelines is no more than 1,500 to 2,000 milligrams per day, roughly half a teaspoon of table salt in total. This is a level that requires attention, not so much to the salt shaker, which most people have already reduced, but to the hidden sodium embedded in processed, packaged, canned, and restaurant foods. Processed soups and broths can contain 800 to 1,200 milligrams of sodium per serving. Bread, deli meats, cheese, condiments, sauces, and ready meals regularly contain amounts that would use up the day's budget in a single sitting. Even foods that don't taste particularly salty, cereals, biscuits, packaged seasonings, often contain significant sodium. The transition to a low-sodium diet requires reading labels methodically, looking for sodium content per serving, and choosing products with less than 140 milligrams per 100 grams wherever possible. It requires cooking from whole ingredients rather than packets, and it requires replacing salt-based flavor with herbs, spices, citrus, garlic, ginger, and vinegars that add complexity and satisfaction without sodium. Within 2 to 4 weeks of meaningfully reducing sodium intake, most people with sodium-sensitive hypertension see a measurable reduction in blood pressure, and with it, a reduction in the pressure burden their kidneys are carrying every moment of the day. Start today. Read the sodium label on every packaged product you use this week. Replace canned soups with homemade versions using low-sodium stock. Remove the salt shaker from the table. Season cooking with garlic, lemon juice, cumin, turmeric, and herbs instead. Request low-sodium options when eating outside the home. Manage blood sugar, even if you're not diabetic. Cutting off one of the kidney's most destructive enemies, blood sugar management, is kidney protection. These two things are not separate topics. They are, at the biological level, the same conversation. Even in people who have not been diagnosed with diabetes, chronically elevated blood glucose, the kind that follows repeated large meals of refined carbohydrates, sugary beverages, and highly processed foods, causes cumulative damage to the kidney's microvasculature through a process called glycation. Glucose molecules attach to proteins in blood vessel walls, stiffening and damaging the glomerular capillaries over time. This process does not announce itself. It unfolds quietly over years, eroding kidney filtration capacity well before any formal diabetes diagnosis is made. Research on people with prediabetes, a condition affecting an enormous proportion of adults over 60, shows that kidney function markers, including GFR and urine protein, can already be deteriorating during this intermediate phase. Waiting for a diabetes diagnosis before addressing blood sugar is not a medically sound strategy for kidney protection. The dietary approach that best protects blood sugar and thereby protects the kidneys centers on three principles. First, replacing refined carbohydrates with complex, fiber-rich ones, vegetables, legumes, whole grains, and low-sugar fruits instead of white bread, white rice, pastries, sugary cereals, and sweet beverages. Fiber slows glucose absorption, reducing the height and duration of post-meal blood sugar spikes. Second, distributing carbohydrate intake across smaller, more frequent meals rather than consuming large amounts at once, a pattern that minimizes the peaks in blood glucose that drive glycation and oxidative stress. Third, incorporating movement after meals. Even a gentle 15-minute walk following a meal has been shown to meaningfully reduce post-meal blood glucose. Muscles actively take up glucose during movement, reducing the amount circulating in the blood and the time it spends at elevated levels. For those already on blood sugar medication, the above dietary approach complements pharmacological management rather than replacing it. For those not yet on medication, these changes can have a substantial and measurable impact on both HbA1c levels and kidney function markers over a period of weeks to months. Start today. Replace your breakfast starch with a lower glycemic option, eggs with vegetables instead of toast and jam, for example, or plain Greek yogurt with berries instead of sweetened cereal. Eliminate sugary beverages entirely. Take a 10 to 15 minute walk after your largest meal of the day. Ask your doctor to check your HbA1c if it has not been tested recently. This final action is perhaps the most important one that people consistently overlook, and it is one that requires a conversation with your physician rather than a unilateral decision. But it begins with you doing your homework. The kidneys are the primary route of excretion for many medications. When kidney function is reduced, drugs that are normally cleared efficiently can accumulate to higher concentrations in the blood, sometimes reaching levels that cause direct toxicity to the very kidney tissue responsible for clearing them. At the same time, certain medications place a direct chemical burden on kidney cells, regardless of accumulation, causing oxidative stress and inflammation in renal tissue. The most commonly encountered kidney-stressing medications in older adults are nonsteroidal anti-inflammatory drugs, NSAIDs, ibuprofen, naproxen, diclofenac, and related compounds. These are available over the counter and are widely used for pain, inflammation, and fever. Many people take them regularly without awareness of their renal effects. NSAIDs reduce prostaglandin synthesis. Prostaglandins are compounds the kidney uses to maintain blood flow through its own filtering structures. Without adequate prostaglandins, the kidney's blood supply is compromised, particularly in people who are already dehydrated or have reduced baseline function. For older adults with elevated creatinine, regular NSAID use can cause significant and rapid worsening of kidney function. The conversation with your physician should include a frank discussion of whether NSAIDs can be replaced with alternatives, acetaminophen for pain in appropriate doses, or other non-nephrotoxic options for inflammation management. Beyond NSAIDs, the review should encompass antibiotics. Some classes are nephrotoxic and require dose adjustment in reduced kidney function. Contrast agents used in CT scans and angiography. Your radiologist and physician need to know your creatinine level before these are administered, and any herbal or natural supplements you are taking. This last category surprises many people, but numerous herbal products, including aristolochic acid-containing herbs, high-dose vitamin C supplementation, certain Ayurvedic preparations, and products containing chromium or germanium have documented nephrotoxic effects. The critical message is this: your physician can only protect you from risks they know about. Bring every medication, every supplement, every herbal product you take, prescription, over-the-counter, and natural, to your next appointment. Ask specifically whether any of them need to be adjusted, reduced, or discontinued given your current kidney function. And never stop a prescribed medication without your physician's guidance, even if you suspect it is contributing to elevated creatinine. The risk of stopping must be weighed against the risk of continuing, and that is a clinical judgment. Start today. Make a complete list of everything you take, every prescription medication, every over-the-counter drug, every supplement, vitamin, herbal product, and traditional remedy. Note the dose and frequency. Bring this list to your next medical appointment and specifically ask, given my creatinine level and kidney function, are any of these putting additional stress on my kidneys? This single conversation could be one of the most important you have this year. These 5 steps work together, not in isolation. I want to take a moment to make something clear about how these 5 actions relate to each other, because understanding this changes how you approach them. Each of the 5 steps we've discussed addresses a different pathway of kidney damage. Hydration optimizes blood flow. Protein reduction lowers the waste load. Sodium reduction reduces blood pressure and vessel stress. Blood sugar management protects the glomerular microvasculature. Medication review removes hidden chemical burdens. When even 2 or 3 of these are implemented simultaneously, their effects compound. Lower blood pressure and improved blood flow together deliver more oxygen to kidney tissue. Reduced protein waste and better hydration together improve the kidney's ability to clear what remains. Stable blood sugar and lower sodium together reduce the inflammatory burden on glomerular cells. The biology is synergistic, and the combined impact of multiple protective changes is meaningfully greater than any single intervention alone. This is why I always encourage people not to approach this as a list where they pick their favorite item. Implement as many as possible as soon as possible. Start with whichever feels most actionable today. Hydration is the easiest entry point for most people, and layer the others in as quickly as you practically can. What to eat? A simple framework for kidney protective eating. Rather than a detailed meal plan, I want to give you a simple framework that makes decision-making at the grocery store, at the restaurant, and at the table far more straightforward. Foods to prioritize. Vegetables of all kinds, except those very high in potassium if your physician has flagged hyperkalemia. Leafy greens, cauliflower, cabbage, green beans, broccoli, courgette, bell peppers. Fruits with lower potassium and phosphorus loads. Apples, berries, grapes, pears, and cherries. Plant-based proteins. Lentils, chickpeas, tofu, tempeh. Egg whites and small portions of whole eggs. Fish and poultry in moderate portions. Healthy fats such as olive oil, avocado, and walnuts in moderation. Whole grains in portions that fit within your carbohydrate targets. Brown rice, oats, barley. Foods to reduce significantly or eliminate. Red meat and processed meats, which carry high nitrogen waste loads and are frequently high in phosphorus, sodium, and saturated fat. Dairy products in large quantities, which are high in phosphorus, relevant in more advanced kidney disease. canned and packaged foods with high sodium content, sugary foods and beverages, alcohol, which is dehydrating, metabolically costly, and interacts with many medications. A practical touchstone: if it grew in the ground or swam in clean water, it is probably working with your kidneys. If it came in a packet, tin, or fast food wrapper, it is probably working against them. Monitoring, knowing your numbers over time. One of the most empowering things you can do alongside these 5 actions is request regular follow-up testing so you can see the trajectory of your kidney function over time. The key markers worth tracking with your physician are serum creatinine and the calculated eGFR, urine albumin to creatinine ratio, which tells you whether protein is leaking into the urine, an early and sensitive marker of glomerular damage, blood pressure at each visit, HbA1c if you have diabetes or prediabetes, and electrolytes, including potassium and phosphorus, which can become dysregulated in more advanced kidney disease. Seeing these numbers improve over weeks and months as you implement these changes is not only clinically meaningful, it is profoundly motivating. Progress you can measure is progress you will sustain. Working with your medical team, not around them. Everything in this video is designed to complement your medical care, not replace it. If your creatinine is elevated, the most important professional you can build a relationship with is a nephrologist, a kidney specialist, particularly if your eGFR has dropped below 60. Many primary care physicians refer patients to nephrology only when disease has already significantly advanced. If you have not been referred and your numbers are concerning, you can ask your primary care physician whether a nephrology consultation would be appropriate. A renal dietitian is another specialist whose value is consistently underutilized. The dietary management of kidney disease is genuinely complex. The appropriate targets for protein, potassium, phosphorus, and fluid vary significantly depending on the stage of disease, the presence of other conditions, and the individual's nutritional status. A renal dietitian can create a plan specific to your numbers and your life, not a generic template. I want to close with something that I believe with great conviction, drawn from years of working with older adults navigating exactly this kind of health challenge. There is a version of the story where you receive a high creatinine result, feel overwhelmed and frightened, put the paperwork in a drawer, and hope the next blood test shows something different. Many people take this path, and for them, the next test often does show something different, not in the direction they hoped. And then there is a version where you hear the number, feel the weight of it, and then decide deliberately, calmly, with clear eyes that you are going to do something about it. You are going to drink more water, eat less salt, reduce the red meat, take a walk after dinner, and bring your medication list to your next appointment. You are going to treat your kidneys with the same attentiveness and respect that they have given your body silently for every year of your life. The kidneys are extraordinarily resilient organs. They have significant reserve capacity, and in the early and moderate stages of disease, they respond meaningfully to the right conditions. What we have covered today, these 5 actions, are not dramatic. They are not expensive or complicated, but they are exactly the right conditions, and consistency with the right conditions over weeks and months changes the story. You are not a bystander in this. You are the most important participant in your own kidney health, and you now have a clear, actionable plan for what to do next. Start today. Not tomorrow, not after the next test, today. With a glass of water, a phone call to your physician's office, and the quiet decision that your kidneys deserve better than they have been getting. I'm Dr. William, and I'm genuinely glad you are here for this conversation. Look after your kidneys. They are looking after everything else.